I'd like to welcome back to From the Front Lines Mr. Christian Shalgian. Christian is the Director of the Division of Advocacy and Healthcare Policy at the American College of Surgeons. And we've invited Christian back, which is attestation to the important role he plays in interfacing between the ACS and Washington, D.C. It's a critical role for us, and more importantly, for our patients in ensuring access of patients to appropriate health care in the U.S. Christian, last night, Medicare released their annual proposed Medicare physician fee schedule. Could you summarize it for us?
Sure, Dr. Wexner. I appreciate the invitation to come back. Last night, Medicare released the physician fee schedule proposed rule. This is an annual event happening each summer for the following year's physician fee schedule. This is a proposed rule. The big thing that was included in the proposed rule was a substantial increase for primary care physicians, for primary care office visits and the like. For example, the family physicians are estimated to get a 13% increase under the proposed rule that was released last night. Unfortunately, the problem that we're facing here is the fact that the pie, if you will, for how big Medicare payments, the pot of money for Medicare physician payment didn't grow any larger. And so in order to give these increases to primary care, they have substantially cut surgeons and other physicians, and these are substantial cuts.
That's very unfortunate, and I thank you for sharing it. But could you give us some idea of what is the magnitude of the cuts? And are the cuts equal across various surgical specialties?
The cuts are enormous across surgical specialties. They vary slightly depending on how much office work is done by surgical specialty. For example, orthopedic surgery is expected to get a 5% cut, colon rectal surgery 5%, ophthalmology would see a 6% cut. There's a number of surgical specialties that are estimated to get a 7% cut, general surgery, neurosurgery, plastic, vascular, and some of the largest cuts would be seen by colleagues in thoracic and cardiac surgery, which would see an 8 and 9% cut. So these are substantial cuts that can't be sustained.
Are you aware of any cuts for other interventional procedures? For example, in our surgeon-specific registry, one of the most frequently performed procedures by ACS fellows is colonoscopy. Are there cuts in endoscopy as well?
There are cuts in endoscopy as well. These are substantial cuts that everybody's facing. So yes, unless it's really sort of office visit type work, then there are going to be substantial cuts.
So basically, procedures are being cut across the board.
That is correct.
Clearly a problem, and the magnitude of the problem, these 5 to 8% cuts, just to put it in context, how does that compare to cuts in prior years?
These would be some of the largest cuts that we've seen across the board. Various procedures have gone under attack at various points along the way, but as an across-the-board cut, these would be some of the largest cuts that we've seen in Medicare in 20 years or so. The challenge that we're facing is to make the situation even worse. As all surgeons really know, most of the private payers pay based off of Medicare. So they pay a percentage more, a percentage less than Medicare. So when you take a Medicare cut at 7%, for example, if 40% of your population is Medicare-based and 40% is primary care, then 40% is private payer, then you've now just doubled that cut. So I'll give you an example. If a general surgeon, for example, has $200,000 in Medicare revenue in the course of a year, then a 7% cut translates into $14,000 cut. Now, all of a sudden, if you've got an equal amount of private payer, you could see that cut double to $28,000. And that money's not coming back into the system in terms of, it's not just a one-year cut and then the money comes back. That money right now is gone, would be gone out of the system. So this is a substantial challenge that we're facing going forward. And it's a big problem.
Well, certainly an unprecedented or almost unprecedented type of global cut across all procedural specialties, the highest in decades, is of great concern. In addition to the procedures, how are post-op visits affected?
This is an interesting point, because in all the 10-day and 90-day globals, there's a certain number of post-operative visits that are included as part of the 10-day and 90-day global payments. In the past, when Medicare has increased payments for E&M services for office visits, they have made the corresponding changes with regards to the post-operative visits included in the globals. They have chosen not to do that this time. In a very strange move, they have decided not to increase the payments for the office visits and the post-operative, which has made the cut even worse. A good portion of that cut would go away if CMS did what they've done before in the past, which is to increase those payments for those post-operative visits included in the globals. But they didn't do that, which makes the cut as large as it is.
Very, very disturbing indeed. And I'm sure very distressing news for fellows across the country. I'd say we've just been through COVID, but depending where in the country one lives, we've not been through it. I'm experiencing it now in Florida, and I've read that many people in the Midwest are now experiencing it. And so we're now in our 5th month of COVID, with the financial havoc being wreaked by COVID and now pay cuts on top of it. I'm sure our fellows, therefore, want to appropriately respond to help you do your job and to help the college fight on our behalf to hopefully help ensure that patients do get access, that people stay in practice and continue to go into surgery to take care of patients. What's the college doing to help the situation, and what can we do to help the college and help you help our patients?
So there's a number of pieces that are happening here simultaneously. This rule that was put out last night is over 1,300 pages of very detailed Medicare language, and we've got our team here, an incredible team, going through that rule to make sure that we know all the pieces to it backwards and forwards. So that's piece number one. We're in a comment period right now with CMS, with Medicare. The college will be submitting extensive comments to CMS, opposing clear aspects of this rule that are clearly problematic. That's point number two. Point number three is we're looking at congressional action to stop this. This is going to require some intervention by Congress. I talked earlier about sort of the pie not growing any larger, and the budget neutrality aspect of why these cuts are happening, why these cuts are going into effect. Increases for primary care means cuts for others as well. So we want to get Congress to waive budget neutrality. And so we've been in conversations with members of Congress who are looking to help us on these issues, but we need emails, phone calls, activity from surgeons as constituents back to these members of Congress to help to sort of spur this issue along and show that there is support back home for fixing this terrible system that's being created. And so surgeons can go onto the college's website, going to Surgeon's Voice on the college's website, and sending emails. And these emails are critically important. And I used to work, prior to working at the ACS, a number of years ago, I worked in a congressional office. And I can tell you that when members of Congress hear from their constituents, it matters. They keep track of the number of emails and phone calls that they get on these particular issues. And we need to get that number as high as we possibly can to show support for stopping these cuts from going into effect. So that is that's a critical piece as well. And anybody can get on to the college's website to participate in this. All fellows obviously are encouraged to do this, but encourage others as well. It's an open system where anybody can sort of get on, and constituent voices, doesn't matter whether you're a fellow or not, are important to this issue. We need to get that number as high as we possibly can as we go forward on this critical issue.
Is there a length of time for the comment and discussion period after which we've lost the opportunity?
There's a couple of steps here that will happen. We're in a 60-day comment period, which started last night or this morning. So by the end of September, around October 1st or so, the comment period will close, and CMS then will evaluate all the comments and then put out a final rule sometime around Thanksgiving is what they're saying now, around December the 1st, Thanksgiving, December the 1st, and that would go into effect January 1. So that's the CMS part of this, the comment period there. But the congressional side of things, Congress could intervene at any point, and we've got a couple of different opportunities to do just that. That's not tied in directly to the CMS schedule, so kind of working this on dual tracks, if you will, trying to get these cuts stopped.
Excellent. I'm sure the fellows are going to be eager to help. I can't imagine many people relish the idea of a 6 to 8% pay cut, and in your example, $28,000 on $400,000 worth of net revenue. So you mentioned go to the college website. Could you just give a little bit more detail about what somebody does after going to the voice part of the website? How are these letters generated?
Sure. It's a very simple process, particularly for fellows of the college. All you're doing is once you click onto that Surgeon's Voice page, it'll bring up an email form letter email to your member of Congress, to your 2 senators, to your representative, and it can be as simple as clicking a couple of accept, and click send, and those emails will automatically be sent to the congressional offices. If you want to even take it one step further, if you want to modify the letter, if you want to add a personal story to the letter, those letters can be modified and changed and added to, and that's great. That's fantastic. Anything that you can do to help sort of tell the personal story of what's going on in your office, what's going on in your city, your state. Those are fantastic, and they really help to tell the story. So, Surgeon's Voice right off of the college's website. You can do it in as little as 3 clicks, and I know surgeons are incredibly busy. You could do this at 2 a.m. It does. You can do this anytime. Any time of day is perfectly great. So, please, we really encourage everyone to tell their colleagues and hope to get the word out on this.
Well, we're still going to be just as busy, maybe busier in future years, and I'm sure people don't relish the idea of getting remunerated less for being as busy or busier. So I can personally say I've used the website, and it is incredibly easy and very quick, and I encourage fellows to go log on and to go to the voice and to send letters, and non-fellows. It's critically important. I thank you very much for all that you're doing for us to continue to serve our patients, for the college, and for the entire House of Surgery. And anybody watching and listening, please do exactly what Christian's asked and go to the voice and let your voices be heard by your respective representatives on the Hill, so that they're aware of how critical this issue is, and hopefully can rectify the situation before it gets set into law. Thanks again, Christian.
Thank you, sir. Appreciate the help.